Hello wonderful people! In this video today I'm going to be sharing 15 facts about Lyme disease. Lyme is extremely common in the PANS pandas community. I have many friends who both have PANS pandas and Lyme and co-infections, and I myself have recently found out that I probably have Lyme because my symptoms look a lot like Lyme, and I had a blood test which showed that I have 3 out of 4 antibodies to the bacteria that causes Lyme disease. So I have been exposed to it at some point, and I probably have it because I have the symptoms of it. So the first fact we have is that the bacteria that causes Lyme disease is called Borrelia burgdorferi, and the reason the condition is called Lyme disease is because it was first discovered in Lyme, Connecticut. The second fact I have is that not everyone with Lyme disease gets the bullseye rash. This is a distinct rash that is often associated with Lyme disease. In the UK, as per the NICE guidelines, you can get treated for Lyme disease without a positive test result if you have this rash because it is really distinctive of Lyme disease. But interestingly, around 30 to 80% of people do not get this rash, and the reason the statistics vary is because different studies yield different results. But the basic point is that not everyone gets this rash, so you can't think that you don't have Lyme just because you don't have the rash. As well as this, even if you do have the rash, you might not always see it because it might be on your scalp or somewhere else on your body where you're less likely to notice it. The next fact is that it is possible to contract Lyme disease from methods other than tick bites. That is the usual method of being infected with Lyme, but it is also possible to have congenital Lyme disease, which is where you're born with Lyme disease. It can be passed on from a mother who is infected to a baby, and it can be spread in breast milk. There are also some theories that it may be spread sexually for some people. The Borrelia spirochete DNA was detected in 84.6% of genital secretions from people with Lyme disease, according to a study titled Sexual Transmission of Lyme Borreliosis. And there have also been some people in the Lyme community who share that they believe they infected their partner with the condition. However, the CDC fails to recognise this and says that Lyme cannot be sexually transmitted. However, the CDC is known to ignore the more complex cases of Lyme and spread misinformation on the condition. There is also the theory that insects other than ticks can spread the condition because mosquitoes and fleas have been found to carry the bacteria that causes Lyme. Lyme disease can have hundreds of different symptoms, and it impacts people differently, and symptoms can sometimes change over time. So I wrote a list of the symptoms because there are so many that I couldn't even memorize all of them, but from the list I wrote, the symptoms may include arthritis, which around 40% of people do not get, muscle weakness, muscle atrophy, nerve degeneration, brain inflammation, meningitis, heart block, organ failure, acid reflux, IBS, post-exertional malaise, neuropathy, having stillbirths, ME-like symptoms, tingling and numbness in parts of the body, nausea and vomiting, POTS-like symptoms, tremors, walking problems, depression, hallucinations, sensitivities to light and sound, vertigo, poor balance, white matter lesions in the brain, blood pressure changes, severe stomach pain, swelling around the eyes, fevers, chills, swallowing problems, chronic pain that moves around the body, neck pain, optic neuritis, which is inflammation of the optic nerve, trouble breathing, neck stiffness, neck weakness, mood swings, trouble speaking, headaches, increased risk of autoimmunity, OCD-like traits from Lyme causing PANS, and many others. Fact number 6 is that Lyme can be life-threatening in some cases, but this is rare. So some people do develop Lyme carditis, which is when the bacteria invades the heart, and that can be life-threatening. It often manifests as heart block, which is where there is a disruption to a node in the heart that causes abnormal heart activity, and around 1 to 5% of people with Lyme have this, and some people also develop issues associated with inflammation in the heart. Sadly, in 2017, there was a case of a 25-year-old man who died from Lyme carditis, and his family were awarded $6.5 million in compensation after the doctor failed to recognise that this man had Lyme disease, but he was misdiagnosed with a virus and skin infection. That man's name was Peter Smith, and sadly, if people are undiagnosed with Lyme or misdiagnosed with other things, that can happen. In rarer cases, some people experience respiratory depression due to weakness, muscle problems, and nerve degeneration. Between 1999 to 2003, there were 114 deaths associated with Lyme disease in the USA. Sadly, suicide is a common cause of death in people with Lyme disease. Lyme disease doesn't always get better with simple antibiotics. This is why some people have chronic Lyme. A 2014 study found that doxycycline left 75% of cells viable when used on a culture made up of Borrelia, round body cells, and biofilms. The bacteria that cause Lyme can change from a spirochete form to a round body/cyst form. These have higher antibiotic resistance than the spirochete form. A 1995 study found that doxycycline, which is the CDC recommended antibiotic, pushed the spirochetes into round body form, making them harder to treat. The antibiotic ceftriaxone left 68% of round body cells viable compared to 31% of spirochete form. Fact number 8 is that Lyme disease often doesn't occur on its own. People with Lyme disease will often have co-infections such as Bartonella, Babesia, and more, such as Mycoplasma. There are many different ones, and it's really important to get tested for all of them. Almond labs do test for different ones. As well as this, Lyme can suppress the immune system, making you more vulnerable to issues such as mold poisoning. You might inhale mold or be near mold, and that may increase inflammation in the body and make it harder to get better from Lyme, because you may also be dealing with mold illness. Lyme disease does often go misdiagnosed. In the acute stages, it can look a lot like the flu, so doctors will often just say, oh, it's the flu, especially if you don't have the distinct bullseye rash. And in chronic cases, or when you've had it for a really long time and it hasn't been detected, it can highly resemble myalgic encephalomyelitis, also known as chronic fatigue syndrome, but that isn't really an accurate name for it. But it is often misdiagnosed as that. There is a Welsh musician called Ren who was misdiagnosed with ME when he actually has Lyme disease. And as well as this, it can also be misdiagnosed as multiple sclerosis, because Lyme is known to cause white matter lesions in the brain, which is pretty much what people with multiple sclerosis have. And the symptoms can look the same, so people do often get misdiagnosed with MS when they actually have Lyme disease. There have also been studies that have associated ALS with Lyme disease, because they have found the Lyme bacteria in the brains of people with ALS. And as well as this, there have been people who are misdiagnosed with ALS, and then they started getting treated for Lyme, and then they got better, and they weren't progressing, they weren't getting worse, they were getting better, which often doesn't happen with ALS. Some people are misdiagnosed with fibromyalgia, because Lyme can cause chronic pain that sometimes moves around the body. And some people are also diagnosed with functional neurological disorder, because Lyme can cause many neurological symptoms. According to the New Scientist website, more than 1 in 7 people in the world have had Lyme disease, so it is incredibly common. But sadly, according to the Caldwell Lyme Co. organisation, 1 in 3 people with Lyme never get better. Women are 2.5 times more likely to suffer from chronic Lyme. The standard Lyme tests used by most American doctors and under the NHS in the UK are highly inaccurate. Many people who test negative on these tests will test positive on overseas testing. I tested positive on Armin Labs, which is in Germany, so it's really important, if you get a negative test result on the NHS or by a American doctor, if it's the usual ELISA test used, know that that could be a false negative, and there is a chance that you could still have Lyme. Most Lyme tests just test the antibodies associated with Lyme, but some people have immune suppression, so their body can't even produce those antibodies, because Lyme itself can cause immune suppression. So, you're not always going to produce those antibodies. I was lucky that I did. I had the antibodies, but not everyone does. And as well as this, Lyme bacteria is known to hide in parts of the body where the immune system isn't going to detect it. This is why a lot of people test with Armin Labs, IGeneX Labs, or DNA Connections. Fact number 12 is that there are organisations such as Lyme Aid for Kids, the Limelight Foundation, the Lyme Treatment Access Programme, and the Lyme Treatment Foundation Incorporated that can sometimes help covering the costs of Lyme disease testing and treatment, because even in the UK, you often can't afford treatment for Lyme. The NHS isn't usually that helpful, especially when it comes to chronic Lyme. They can't really treat it that well, and that's why some people do have to go abroad for treatment. I was told that if the treatment at the private clinic doesn't work in the UK, then my best bet might be to go to Poland, but I hope it doesn't come to that. Fact number 13 is that you can prevent Lyme disease, especially the form spread by ticks, because Lyme is often spread in woodland sort of areas and places with very long grass. So if you use a tick repellent spray, they can be natural. You can get natural tick repellent spray that just creates a scent that the ticks don't like, so they'll leave you alone. And if you tuck your trousers into your socks or boots, which may look strange but could save you from years or decades worth of suffering, do those things, take those precautions, and when you come back from, going in the woodlands or something, do change your clothes and check for ticks. Do this in the UK as well, because you can get Lyme in the UK. I learned that the hard way. I used to think it was a disease that just really affected people in America and other parts of the world, but I was wrong because I've never been outside of the UK and I still tested positive for the antibodies, so that shows I've been exposed to it. The places in the UK where you're more likely to contract Lyme include the Scottish Highlands and southern England, but really you can get it pretty much anywhere. I've kind of already touched upon this, but so many people have to pay so much money to get Lyme treatment. There are so many fundraisers from people desperate to get life-saving care, because a lot of doctors say that chronic Lyme doesn't exist, even though it does, especially if you have proof of the round body/cyst form, and if you have biofilms, or if it has just wreaked havoc on your immune system and you're not able to get rid of it. Chronic Lyme does exist, and it's incredibly neglectful and dangerous that a lot of doctors will just say, oh, it's chronic fatigue syndrome, without saying, well, why are they fatigued then, and why are they struggling with post-exertional malaise, why are they struggling with all these symptoms? Because they usually can't give an answer, and they'll say, oh, it's psychosomatic. No, it's not. You have to find the root cause, and a lot of conventional medicine doctors don't do that, so they don't really recognise chronic Lyme, which is why a lot of people have to pay a lot of money to get the appropriate care. So on the Daily Record website, there was a story of a mum and her son who both have Lyme disease, and they face the risk of a slow death without £10,000 treatment. It's even worse than I thought. £100,000 treatment. That's even worse than I thought. They face the risk of slow death without £100,000 treatment that they can't get on the NHS. And there's also a story on the same news site about a Scottish woman who was forced to pay private for Lyme treatment after the NHS disregarded her diagnosis. The last fact I have for you today is that dormant Lyme can be reactivated and cause symptoms in your body when triggered by stress or something else that is triggering your immune system, such as the virus that a few years ago made us all have to stay at home. I'm not going to go into that, but also mold exposure is known to trigger dormant Lyme into active Lyme as well, and that can mean that you start having the symptoms. Just because a condition is triggered by stress doesn't mean it's psychosomatic. It could be reactivating something like Lyme or Epstein-Barr virus. I am sorry that my hair is kind of gross. I wasn't able to brush it. I hope that this video is informative in some way. I know it's not the highest quality. I'm filming this at past 3 a.m. because I actually slept all day because I was too ill all day to film, and I've been wanting to film for the past few days, but I haven't been able to. So, that's not great. But on a positive note, my TEDx talk was out on YouTube about a month ago. So if you haven't seen that, you might want to see that. It's on their YouTube channel and on the TED.com website. I will link it down below. On my TEDx talk, I do talk about OCD, pandas, autism, Tourette's, ADHD, those sorts of things. So, if you want to learn more about those things, then click that link. And if you have family members who try and say that your child is just naughty or needs more discipline, then that is definitely the talk to watch and send to them. I will also be linking in the description links to websites about Lyme disease where you can find, these facts and statistics, and I really hope that that's helpful. I'm currently reading a book about Lyme to learn more since getting my test result, and I am going to see a Lyme specialist soon, and I'll likely be put on antibiotics and herbal remedies, I believe. So, I hope that goes well. And I'm also seeing a cardiologist soon, so hopefully I will have all the answers I need soon, and we'll start getting better. Thank you for watching. Bye!